Good morning, Mr. Chair and Commissioners. We just have a one-page form this time. There's been a system issue with a system called MEDS, is where we get our most accurate information. So this information is actually of the 7th of September. So I'll just go through some of the numbers we have just in a little different format. So as you see, Clay County, we have 1,011 positive cases, so that's up a bit more than our last numbers that we have received, about 130. I think our last count was 880. So there's a few more confirmed positive cases. There's no increase in deaths. We still have 40 deaths that we've had for a number of weeks. Our 14-day case rate per 10,000, that is 7.80, and that is the number that the schools have been using to determine how they're going to start their classes. They've used that number. If it's below 10, they have the ability to do in person. And if it's over 10, there's recommendations about a hybrid. So of course, all the K-12 schools are starting today, but that's the case rate that we give the schools so they can make the determination about what options they have for their learning modules. And then number of cases who no longer need isolation is 795. Now that was updated just as of September 3rd. So there's some changes that MDH is making with their numbers, and maybe why we see the variance of positive cases. We still are having delays from the North Dakota Public Health Lab. So there's delays in that, and we also still are not getting the negative number of testing from them. Our Minnesota confirmed positive cases are at 81,225. And so there's 638 newly reported cases.
This information that you're reporting here, does this go out to the public at all anywhere, or do they get this?
Yes, our
Like
PIO.
people watching the meeting this morning, do they get?
Correct. Our PIO puts it out on our public health Facebook page as well as the website.
Okay,
So
thank you.
yes, the public does get all of this information.
I got a question for you, Kathy.
Sure.
Newly reported cases, 638. Is that for one day?
The newly reported cases,
Yes.
that is, let me just look at that. Oh, the Minnesota cases, yes.
Which day is that?
That would be as of September 7th.
So on September 7th, 638 new cases were reported?
Correct.
Is that correct? Is that how I'm reading? How many were tested that day?
They just have the positive cases. She doesn't have the, completed tests. The number of completed tests on 9/6, if you see underneath that 7-day positivity rate, is 15,147.
So then if we take 638 and divide it by 15,147,
Of the newly reported cases you're taking,
yeah,
and then the number of completed tests.
that's correct for that date.
And you should get
That's 4.2%.
Well, and they do a 7-day positivity rate, so they don't just take 1 day. They do a positivity
But on that
rate.
date that you have the newly reported cases, the rate is
Right.
4.2%.
Yeah, and the 7-day rate, that weekly rate is 5.5, just because of the
Okay.
reporting delays. So they do the 7-day positivity rate is why
Okay.
they have that difference.
All right.
And then, of course, we talked about the hospitalizations. That's in Minnesota. How many people were hospitalized, how many in intensive care. We do know that does not include those hospitalizations over in Sanford and Essentia. And we've talked about the challenges of getting that information on a regular basis. We've been working hard to try to get reports on the number of hospitalizations for the Clay County residents in Sanford and Essentia, and we're still working on that process. It seems to be challenging to get that information. And then we get the United States confirmed positive cases at 6 million, almost 6.4, and then deaths, 192,000. And then globally, the 27,889,000 deaths globally. So that's the information, that's all we were able to compile for this meeting, so I apologize you don't have all of it, but at least some of the most current data that we could get. Our med system should be up and running again today, so that's where we get all of the data.
So these cases that you're talking about, people from Minnesota that are in Ascension, Sanford, are they reported on the North Dakota side then? As cases?
They report the people can get the North Dakota, or the officials can get the North Dakota numbers of ICU.
But it's going to include Minnesota people.
Right, that does not include, yep. In the last data I got it was very minimal number of people.
Okay, very good.
It was just a couple people.
Well, that's what I was thinking, that
Yeah.
the number can't be that great.
No, they're not. They're not large. Now, the hospitalizations in Minnesota, if somebody was hospitalized in some of the hospitals in Minnesota from Clay County, those would be counted in the Minnesota
Yes.
cases.
Okay,
Mr. Chair,
yeah.
I just want to see if my math is correct here, Kathy, based on this one report. So Clay County's had 1,011 positive cases as of September 7th. And as of September 7th, we have 795 no longer needing isolation. So that means they're probably not,
Recovered.
they're recovered.
Yep. And that was of, excuse me, Commissioner Campbell, that was of 9/3?
Okay, so in
So-
both instances?
No, the September 7th number, the confirmed cases are 1,011, but it was only 9/3 that we know of the people that are out of isolation.
Okay, so
So there's a few
probably would have
days.
been a few more, some more that
Correct.
would have come, because I guess where I was going with that is, had those been the same day, we'd have 216 minus the deaths would have been 176 active cases,
Right,
which would have been 3 times our highest.
right,
That's what was concerning to me.
correct. Yes. So the number of, and that, we get completely off that med system, which it was down.
Because
So
as the numbers were here now, it would show that we'd have 176 active cases. Last week we had 50.
Right, right. And again, it's all the delays in the reporting. That's the hardship of this system, is there's such a delay in some of that reporting. Plus the confirmed cases and the people out of isolation, that changes so frequently that I would say it's not completely accurate. So you're right about that. The confirmed positive cases, we have a few more cases now that the college students are back. We
Right.
expected the cases to go up a bit. And I reported, I think, last week that the numbers were pretty low at our higher ed, but of course they've increased now, just like they are in any of the other higher ed systems on the North Dakota side and across the nation. We're seeing numbers that are increasing, and that was, we were expecting that. So we're also seeing the numbers. We're working closely with the higher ed to follow up on all those cases, but we're seeing numbers go up.
Jamie, you look like you've got something to say.
Not a lot to share today, but a few things from, the focus for last week from the Minnesota Department of Health was on messaging with the holiday weekend coming up. And there was new guidance that came out. A lot of the new guidance was basically supporting masking and social distancing. So one of those was vehicle gatherings, parades, and drive-ins. So basically the messaging about masking and the 6-foot distancing. There was also information on safe celebrations and events, weddings, those type of gatherings. And then also addressing private homes, and not new information, but just stressing that a private home, you can have 10 people indoor and 25 people outdoor. That's what's in the governor's ordinance. And so basically the messaging is not new, but they're just kind of getting it out there, preparing for the holiday weekend. Looking at, Kathy talked about, we spent a lot of time working with our higher ed last week, and we had a meeting with Minnesota Department of Health, which actually said they're doing a great job in Clay County and higher ed compared to other parts of the state. But reality is we are seeing some cases, and it is having an impact on our workforce. So we've been working with some of our workforce partners in the community as well to support them with that impact. And so that's pretty much what happened last week, and preparing for the holiday weekend, and hopefully there was a lot of compliance with that.
Are there any guidelines that changed as far as churches and stuff like that?
No
Or does
changes.
the governor
No
put out any
changes.
guidelines? Does the churches do that, or the governor do that?
That guidance was put out. They had to have plans for being open, and that has not changed. Let's see. Another thing they kind of talked about, there was more guidance on sporting events, but again, it wasn't really new. It was the messaging of the types of sporting events and adults and children and what kind of events you can have. And then also music activities, those are the things that the schools were asking more questions, so they put out guidance, but it was not new information.
Is there any supervision yet on this? I mean, I know we got guidance, but does anybody supervise this yet? I mean, does anybody go to a sporting event and say, move over, or?
Sometimes it's a self-reporting, and we'll hear about incidences or events. Someone will report that something was going on. With the establishments, we have Minnesota Department of Health is doing random checks as well as targeted checks for establishments that they're hearing about that are maybe not compliant. That's across the state. So they're doing some random checks, and they're also doing some targeted checks. And with those establishments, those are licensed establishments, our food pool and lodging staff will get word of that for follow-up. So
Okay.
they're doing more of those checks, but so far, it's been about 3 weekends they've been doing that. They've been pretty compliant, so there hasn't been big issues that they've noticed so far. So, but a lot of that, we have received reports of maybe someone working in an establishment not wearing a mask. So our food pool and lodging sanitarians will follow up on that, just to provide the information.
Okay.
One thing we wanted to caution the public, some people are getting all of their information on social media, so we have to be very cautious about that. We're reminding people to be watching the credible sources of information. So the stuff that public health puts out is of course credible, but MDH, Minnesota Department of Health, Center for Disease Control are where some of those credible sources are. So to be cautious about getting your information on social media. One of the rumors that was flying around is about children being taken away from their families by social services if they tested positive, and we want to dispel that. That's totally a myth. If there's children that are tested positive, they are not removed from the home from social services. So that's completely a myth, and unfortunately that was floating around social media. So we really want people to be reminded that, make sure you check your credible sources.
Good point.
Any questions? I know it's been brief today, and but any questions that you may have that we haven't
okay.
answered?
No, thank you for your update again.
Okay, thank you.